go call a session is starting. So I tell them I am the one who is doing the session. You understood what is it? In some college, watchman asked me to show my ID card. He I am a student. I said, I showed a banner in which my photo is there. I am the speaker, not participant. So you can connect with me. And this is my way of listening. If any person is listening to me or not. So Sara has made some nice introduction. Most of the time students don't listen. When I start my talk, I say, just tell me one point which you listen from my introduction. Everybody is blank. It means what? They never listen to what they said. Then they become little attentive. Okay? So now because of this YouTube restriction, I am speaking from here, otherwise, like I will roam here and there. So the point is, even if you don't know about my introduction, it is fine. But at least the topic which I am going to talk, that you should listen. That's all. Along with that, if you know the person who is speaking, then that will make more sense. So I will give a little introduction about myself. So can you recognize that person? So who is he? What's his name? Thanks. At least now, after this seminar, you know my name. So these are all the projects which I am doing currently. Okay? You can see logos of all the different organizations, right? So in my life, I never applied for any job. Okay? But I am working with all these organizations. I am not working for them. I am not their employee. I am working with them. Okay? You understand what I am saying? There is a difference. And when I got these opportunities, half of the times they approached me, knowing about my background, my expertise. Other half, I approach them proactively. Okay? So you can get opportunities in two ways. If you have a good profile, people will approach you. You understand what I am saying? But if you not have that great profile, we should approach them. Both are fine. You understand? Whether they approach us or you approach them, it does not matter. But none of this organization asked me my qualification. So they don't care if I am A farm, B farm, C farm, D farm, whatever farm. Okay? You understand what I am saying? If I am farm D, none of them care if I am a farm D or an N farm. What they want is how can I contribute to their organization. If that you can make it clear, it does not matter what is your qualification, how much percentage you have, how many backlogs you have. I don't have any, and I am not encouraging to have backlogs. But I am saying all of that will not really matter. Okay, if you have the clarity, what is expected from you in that company, you can get opportunities. So one of you can stand and read on the top. There is some sentence which I wrote. So can somebody stand and read? No need of night. Just N.A.D.U. college. 2-year-old kids. So you want to read just 5-6 words. Okay, boys. Don't worry. Just read what is there on top of my pen. See, this hall, I don't know, maybe 200 people are here. So do you think? So that is not a bomb, okay? So that girl is a big color. So they stand. So what's your name? Anusha. So Anusha, read that what is written.
All of you can do ask.
So all of you clap for her. And if you have spoken, people would have clapped for you. You missed that chance. And in life, I am demonstrating how people miss those chances. And again, I am saying in this hall, this many people are there. Do you think I will remember each one of you? Definitely not. But I will definitely remember Anusha. And if I can help her, I will help her. So from this, what message I am trying to give is when some opportunity comes, you should practically take it. You should not be afraid. Why are you afraid? Because you think other person might think something. let them think that is their headache. You understand? That is their problem, right? It is not your problem. But most of the time, nobody has time to think anything about you. It is our just false conception that we think some other person will think something nonsense about us. Okay? So, did you understand the message which I am trying to get there? Qualification wise, my qualification is not different to your qualification. After certain period of time, you will see. You will also have a pharmacy degree. I also have a pharmacy degree. Degree wise, we are not different. You understand? I studied in Hyderabad, which is in India. We are studying, I don't know wherever, but we are studying in India. Right? So the country from which I have pharmacy qualification is also the same. And unfortunately or fortunately, I am from first class. So no seniors to guide, nobody to help. We have a lot of seniors, though they don't give suggestions and guidance, but at least we have somebody to ask, right, for suggestion or information or guidance. So I am saying, if I am able to do this, you should do much more than what I did. Especially because you have more exposure and guidance compared to what we have. So far whatever I spoke, you understand? So say yes if you have understood. Does that make sense to you? See, my intention today is at least few points. Ideally, every point which I take, you should understand and take it home. If not all those points, at least few very important parts you should be able to take home. Okay? So now pick up just one organization from this entire thing. I will talk what I will do in that organization. So who wants to select? I cannot talk about all of them, but pick up one organization. I will tell you what I do with that one organization. Sir, when my time is up, please tell me. It should not take a lot of time. They are asking you to select one. I did not take you to a shopping mall and ask you to select a saree. Okay? So that time you can take a lot of time. First thing, I don't know why IPS CPD is very prominent. Everybody is asking IPS. Anyways, I can talk about it, but that is relevant more for family. Many students will ask me, sir, what should I do after family? Or BPharm, we have that question, what should you do after BPharm? So you want to know my standard answer? First do your BPharm properly, then we will see. Okay. So we are always interested in something for future and we ignore what we are doing today. BPharms are interested what to do after BPharm. Pharmacists want to know what to do after pharmacy. But nobody is interested in to do whatever they are doing today. So for BPharm, I will encourage you to do F-Pharm. At least you should have master's degree. For pharmacists, pharm is enough. You don't have to do anything extra after it. If you do it properly. Okay? So, but in abroad, there are specializations for pharmacists, or especially pharmacy background. They can become an infectious disease clinical pharmacist, oncology clinical pharmacist, nephrology, neurology. So with IPS CPD, we have started a fellowship, 1 year fellowship for pharmacists in infectious diseases. So after pharmacy, they can join that fellowship. It is a fully funded fellowship, means no fees, and you will be given a stipend. So how much stipend can you guess? Twice. If you join that fellowship, we will give you a stipend. How much stipend do you think we are giving? Yes, 50, 50, 100, 1 year, week, 1 month. Okay, girls. Whatever boys say, we will follow. So we are giving 30,000 per month stipend, and that stipend is much bigger than lot of fresher jobs. So that is what we are doing with IPA. So now I will talk about map my genome. So this map my genome that you see here, which is relevant to my talk. Okay. So my talk, what is the title of the presentation? Precision medicine. So I am not talking anything theory. I am implementing precision medicine with map my genome in Hyderabad. Okay. So I will talk about that. So I will not talk information from internet based sites and data. If I talk, I will talk about things which are done, or things which are understandable, otherwise I will stay away. Okay. So, map my genome, what I do, I will share with you. So far, whatever I spoke, do you like it? So, clap for that. So, rest of them did not like it, it means they did not listen, okay? Listen, it will be useful for you. Understand what it is? So, when you give medications to the patient, we expect that those medications should work. That's all. How many of you have heard about clopidogrel? Clopidogrel. So I am showing you two photos here. This is one of our patients where we did a pharmacogenomic test. Okay. And this is the CEO. This is me. He is my company co-founder. He is a doctor from US. His name is Dr. Ashwini. She is Anu Acharya. She is CEO of PRACTIC. So my company has an MOU with them to implement pharmacogenomics. Okay. And this is the real picture of we implementing pharmacogenomics in real world. So how many of you have heard about clopidogrel? Or what class of drug is it? It's an antiplatelet. Okay. So try to understand. Formation of what? Clots. I can go deeper. Clots can be platelet rich clot, fibrin rich clot. Which clot does clopidogrel inhibit? Yes, so you can use your common sense. It is an anti-platelet drug, so it inhibits platelet clots. You understand what it is? For everything we don't need pharmacology. Sometimes if you use the brain, you can answer. So it's an anti-platelet drug. Okay. In what conditions is it given? In conditions where there is clot. What are those conditions? Thrombosis means clot. So in which conditions you have thrombosis? Did you hear about myocardial infarction? MI. Yes. In MI, there is a clot in the coronary arteries, and because of the clot, blood supply to the heart is decreased. Okay. How to manage that condition? So even first year students, if you just listen to me with attention, you will understand. Heart is an organ. Heart receives blood through coronary arteries. In coronary arteries, if there is a clot, blood supply to the heart will be decreased. So that condition is called MI. Okay, do you understand? So, what will you do? You should remove the clot because the clot is obstructing the flow of blood, right? If you remove the clot, then the blood supply will be restarted. And this clot is formed by whom? Platelets. So what drug will you give? You will give an antiplatelet which dissolves that clot so that the blood vessel becomes free of obstruction and blood will flow. Clear? So do you understand so far? Like otherwise I can quickly present my slides and go, nobody understands anything. You understood, right? So now let's say a patient had an MI. Already once he had an MI. Then you give whatever you give, like you give a stenting or a CABG. You also give antiplatelets, fibrinolytics, contrast-related and aspirin, beta-blockers, all the drugs which are needed to give. So what will be your target? Your target will be that this patient should not get the MI again. So that is called secondary prevention. Secondary prevention means you will prevent the patient from getting the event if they already got. Okay? But the best thing to do is primary prevention. Primary prevention means even before they getting an MI, you identify the risk factors and prevent the patient from getting it. But this patient already got it. So primary prevention you cannot do. But what will you do? You do secondary prevention means you should make sure patient does not get it again. So for secondary prevention, we should give so many drugs. One such drug we give is clopidogrel. Okay. Are you able to understand? Now next. So do you know what is the prodrug? What is the prodrug?
Metabolic converter.
So prodrug doesn't have any pharmacological actions directly. It has to be converted into an active metabolite, right? So is clopidogrel a prodrug? Yes or no? Both will find out. Answer is yes, it's a prodrug. Okay. I only give two options. Even if you select one options, one selected one option, other selected other option, at least half of you are correct. But I gave one clue to students. Whatever you think is correct is wrong. Apply this clue many times, you will be successful. Okay, you understand what is it? You understood? So, if I give you two options, 95% time they select wrong option. Then I decided this is the rule. Whatever you think is wrong, that is correct. Especially that two mark for you. You said it is not a product, but it is. So product means it does not have actions of its own. It has to be converted to an active metabolite. And this active metabolite of clopidogrel shows antiplatelet action. Clear? So now let's say we give a clopidogrel to a patient. It has to be converted to active metabolite. Only then it shows antiplatelet action. That's all. Like how will it convert to an active metabolite? Just like that it will convert. Speaking loud. It has to be converted. How will it convert to an active metabolite? Some enzymes will act on it. So the enzyme in this case is CYP2C19. So when you take clopidogrel, CYP2C19 enzyme will act on clopidogrel and convert it into active metabolite. And what are the actions of that active metabolite? Antiplatelet action. Okay. So now where is this CYP2C19 coming from? It is produced. Ultimately, your organ is okay, but ultimately it comes from your genes, right? There will be certain segment in your DNA. That segment will code for a protein, and that protein will code for this enzyme. Okay? So now if that enzyme is defective, or sorry, if that gene has undergone some polymorphism means the gene is little different than a normal gene. You understand what I am saying? So if you have that DNA, in the DNA there is a gene which is responsible for producing CYP2C19. If the gene is normal, you will produce CYP2C19 and it will be the right candidate for clopidogrel. But in certain patients, the gene undergoes polymorphism. Okay? When it undergoes polymorphism, it will not produce enough CYP219 or it will produce more CYP219. Let's say if it is not producing enough CYP2C19, for such patient you give clopidogrel, what will happen? Will it work? Will it not work? It will not work. Yes. So what's your college name? So United College, at least they are learning something. Other college, Agronomy College, you are hosting me. We should also learn. Do you understand what I am saying? Yes or no? So, but in India, nobody tests for the genetic status before starting clopidogrel. They simply give clopidogrel and expect it will work. That is the traditional medicine. But in precision medicine, we will do this testing before and understand the genetic status of the gene. If it is normal CYP2C19 producing individual, we will give clopidogrel. If the gene has undergone polymorphism, because of polymorphism, either it can produce more enzyme or less enzyme. If it is producing less enzyme, if you give clopidogrel, and there is not enough enzyme to convert it into active metabolite, so it will not show the antiplatelet action. Patient might get MI again. So in India, what happens is when they get it for the second time, then they will think why did they get again? Then right category of clopidogrel. If you bear this, I will give my okay saying it will give you. That is the case. Louder because warfarin is not an antiplatelet, it is an anticoagulant. There is a difference between antiplatelet and anticoagulant. So what I was asking is, aspirin is also an antiplatelet, clopidogrel is also an antiplatelet, and there are other antiplatelets. But what class of antiplatelet is clopidogrel? So it is ADP-V2 bipolar receptor blocker. Other class is, all these things are there in textbook, you don't have to make those. Other class is GP2B3A inhibitors. So these are the three classes of antiplatelets. What are those three? COX inhibitors is one class, ADP-V2 receptor blockers is another class, GP2B3A inhibitors is another class. These are the three classes of antiplatelets. COX inhibitor, aspirin. ADP-V2 bipolar receptor blocker, clopidogrel. GP2B3 inhibitors, will you give an example? So this is what I will exactly suggested you for B.Pharms. If you can increase your B.Pharm knowledge with clinical pharmacology knowledge, then you will be able to take up all these jobs which I showed. You understand? So before clopidogrel, there was a drug called ticlopidine. This is withdrawn from the market because it caused neutropenia. Okay? Then came as clopidogrel. After that, let's say now you have a patient where you cannot take clopidogrel because he is not producing C-like 2C99 cells enough. What will you suggest? You should suggest some other drug from same class. So I am asking what are the other drugs? Prasugrel, ticagrelor, dagrelor, these are all other newer ADP-V2 receptor blockers. So what I am telling you is very basic stuff. Okay? I can make you happy and I can also make you realize what you know is nothing. First I showed Johnson made you happy. Now let me show you. Reality is all these things you should learn. If you know this, then you can apply this knowledge in practice. Application forward first. You should know it. So, and all this you can directly implement in the hospital. As a part way, I implemented all of this in the hospital. Okay. So now did you understand process medicine? Instead of presenting 25 slides, I thought I would take you one case study and explain. So in that way, there are at least 40-50 drugs whose actions are dependent on the genes. If the genes are functioning properly, they will act efficiently. If they don't act, either the drugs don't act or they will be toxic. For example, in this we will see the opposite case. They are producing more C-like to C-negative. What will happen? They convert all of it into active metabolite quickly and they can cause the toxicity. So, you understand what I am saying? So in that way, there are at least 40-50 drugs whose actions are dependent on the genes. If the genes are normal, they will show normal therapeutic action. If the genes have undergone polymorphism, they will either not work efficiently or they will cause toxicity. Okay, clear? This is clear. So another such example is abacavir. Abacavir is one class of drugs. So it's an antiviral. So in patients with HIV, you give abacavir. But certain patients have high chances of getting hypersensitivity reaction to abacavir. Okay? So for such patients, you should not give abacavir. So you should do the testing. There is something called HLA complex genes. If there is a polymorphism in that HLA, these patients have more risk of getting hypersensitivity to abacavir. So in US guidelines are very clear. If you are looking to start abacavir to a patient, First check for HLA status. Okay? If they are not prone to hypersensitivity, then you can give abacavir. If you don't do that and give, and if patient develops abacavir, like your chapter is closed. They will seize your license, you cannot practice in your life again. But in India, you can do anything you want and nobody will question. Okay? You understood? And this is example of a patient. Third example I will give, warfarin. So warfarin, what class of it? What is it? It's an anticoagulant. But again, anticoagulant is a broad class. Under that, what specific class? For example, clopidogrel is antiplatelet. Specific class is? So it is vitamin K antagonist. Okay, so warfarin is a vitamin K antagonist. And even warfarin's actions are dependent on certain enzymes. Okay? So based on the polymorphism of those enzymes, you will determine how much dose of warfarin to give. So this patient was given warfarin for anticoagulation response. Patient was not getting enough anticoagulation response. So we ruled out all the reasons and we thought genetics could be a reason. This is our technician. You conduct swab from the saliva, from the gums. Then we do the testing, we identify the gene and we identify the polymorphism of the gene. Based on the polymorphism, we will determine whether we should give warfarin or not, or if we are giving how much warfarin to give. You understand what is it? So this is simply precision medicine in real practice. So I also as a student attended so many conferences about precision medicine. Everybody will say this is the future, this is the future. But I am saying the future is already here. And I don't think anybody is doing this except me in India. At least with family background. Because PHARMACOLOGY was just a genetic testing company. They test it and they say this polymorphism is there. But the test should be implemented in real world. So I approached the organization and I said, you do the testing. I will be your clinical implementation partner. So they agreed for it. Now patient is getting more comprehensive care instead of just checking if this polymorphism is there. Now I will interpret that report. I will talk to the doctor who is managing the patient. I will give evidence-based recommendation to the doctor to change the drug or change the dose. You understand? And then I will make sure that change is implemented for that patient. I will follow up with that patient and see because of the change in treatment is there a change in outcome or not. You understand? So from this what I am trying to tell you is if you do something you should close the loop. Means you should not just do one part and think you are doing some great job. You should do entire thing. Like I will tell you a little story. You are okay for a story? Stories? Sessions? So three people were taken for an activity. First person's job is to dig a small hole in the ground. Second person should come and keep tree in that hole. Third person should come and fill the hole with the soil. So that is the activity. Clear? So one day what happens? Second person does not come to work. First person comes and digs a hole. Third person comes and closes it. And both of them go to their manager and say, "Sir, job is done." So is the job done? You understood what is it? But they wish that in between something else should happen. Most of the time students' works are like that. Just going to college is not enough. You understand? Going to college is first step. Then you should focus and learn. Then you should try to learn what you are college. Then try to implement that in practice. Then document what good things you have done. So you should also, whatever you are doing in your life, you should try to close the loop. This organization, the loop was open. And I went and created an opportunity for myself. So in that way, every organization which you see on that is how I approached them and created our. All those things are for the first time in India, a family is doing. They are not traditional things. They never existed before. Okay, so, and Human Genome Project was basically created which gave a lot of information about our genes, the enzymes they produce, how they affect the drug's action, all those precision medicine means you will take into consideration individual genetic factors, environmental and also lifestyle factors. All these three factors you will take and design treatments for patients. Okay. So if you see here, so what are the smileys? These are patients. In a traditional approach, you will think that all the patients are same, but it is not right. Each patient is a different individual. So if you see here, these pink color ones, they are responders. Means the majority of them are like usual responders. But there will be few people who will be non-responders. Means drugs don't work for them. For example, if you take this for clopidogrel, these non-responders are the people who don't produce CYP2C19 enzyme enough. Okay? And there will be toxic responders. Means they respond in a toxic way and they are more prone to get a side effect. But generally what you do, you give same drug for all of them. But in precision medicine, you do the genotyping and you segregate the patients into different categories. For normal responders, you can give the drug. For patients who are non-responders, you will give some other drug. For example, in the case of clopidogrel, you will give ticagrelor or cangrelor or prasugrel. And patients who show toxicity, you will reduce the dose. Okay, or you give an alternate drug. You understand what I am saying? So this is like clear depiction of precision medicine. And if you see ACE inhibitors, do you know ACE inhibitors for hypertension? Most commonly used drug for hypertension are ACE inhibitors. Okay. 10 to 30% of the patients have polymorphism in the gene responsible for action of ACE inhibitors. But every person with hypertension is receiving an ACE inhibitor. So it means only 70% of them respond. Other 30% don't respond only because they have some gene which does not let ACE inhibitors act effectively. Understand? So in that way, all these common classes of drugs which use regularly. If you see, in most of the times, 20 to 30% of the patients don't respond. But unfortunately, in India, we get the patient for not responding. We think patient is not taking medications regularly, all that stuff. And other reason could be defective drugs. There is no guarantee the quality of the drug. That could be also a reason. So many reasons are there. One of the reasons could be pharmacogenomics, which we identify and we rectify using precision medicine. Okay. So this line clearly summarizes the difference. In traditional medicine, one size fits all means what? Let's say you give this bracer and give it to everybody in this part to wear. You think everybody will fit this bracer? No. No, right? So in the same way, if you give the same drug for everybody, it will not work. So that is called one size fits all. That is the traditional approach. But precision medicine, you will tailor it to individual person, very specific to that person. Okay. Next, in traditional method, it is trial and error method. You give the drug. If it does not act or if it shows toxicity, then you will look like changing it. But in precision medicine, you do this testing daily. Proactively, you do this testing and give the treatment accordingly. You understand the difference? Then, traditional medicine, it is again reactive treatment. You gave clopidogrel did not work. Patient had secondary MI, then you will react to the secondary MI and try to do something. But here you will do it proactively. In traditional medicine, you will do studies on a broad population. But here you can test it on a specific population. Okay. So even here it shows the same. So if you see, especially this is very important in patients. Specific properties of cancer. All of them have colon cancer, you give a drug. But colon cancer can manifest in multiple different ways. Colon cancer can manifest in multiple different ways. So here what you do is do an analysis. And then you segregate the patients according to their genotype or phenotype. Based on that, you will give specific drug to them. So all of them will respond. Okay. So benefits. Say good. Treatments will be more efficient. Treatment will be less toxic. That is what we expect from every treatment. Right? Ultimately, when you are giving something, You want that something to be efficient. You want that to be less costly or safe, so that you can truly achieve by personal medicine. So in India, the major challenge is the cost. The test which we did, it will test nearly 150 drugs. The test cost is around 7,000 rupees. But that is okay. This is only one time, right? Your genes don't change it. If it is a blood test, we should do it every time. But genetic test only once. So they are cost effective, but patients might think they are more costly compared to traditional tests. But I tell them, this test you are doing only once. You are not doing it every time like a liver test or a kidney function test. The genetic test is just for one time. Okay. So our participants. Hi. You are the people who came. I don't know what you will understand. So these are the resources. So if you ask me, sir, how will I know which drug is affected by a gene? What are the polymorphisms of those genes? What will happen because of that polymorphism? PHARMACOLOGY. So you can refer PHARMACOLOgy. So here it has given clinical guidelines for 155 drugs which are affected by polymorphism in the genes. Okay. And another one is CPIC. So these are the two standard resources for pharmacogenomics and precision. And ARMEDA is my organization. So whenever I get a chance to come and speak, I will generally not deny because I enjoy talking to students, because I feel I have heard certain things which I can share with you, and those things can help you. So quickly I will tell you what was my schedule for last 2 weeks. Then you will understand. So basically November 6th, it started at today is December 6th, right? Hyderabad to Rajahmundry to Betapur to Kakinada to Guntur to Vijayawada to Hyderabad to Bangalore to Erode to Coimbatore to Salem to Delhi to Hyderabad to Narsapur to Warangal to Delhi. From yesterday I came from Delhi here. From here I am going to Hyderabad, from Hyderabad to Bangalore to Rajahmundry. But I gave a compliment to Abraham College and I came. And why I came is for me, the real appreciation is learning something from this session and implementing in your life and team. Otherwise, class I had to handle workshops in 300 colleges so far. I went as a speaker in at least 200-300 conferences. So I have my entire room in my house with all the mementos and stars. I appreciate all of that, but what I appreciate more is you should learn from what I have to offer. Use them and grow successfully. So for that my support will always be there. And quickly I will. So what I meant by showing this is, we don't know before this session each other, right? Now at least we know we met. So our interaction and we should not stop there. We should collaborate beyond this event. With Abhirami College, we will do it at college level. With other colleges, it is up to you. I am extending that offer. If you want to associate, partner, collaborate, learn from me, I am more than happy. So my intention is to create whatever existing opportunities are there, we should grab those opportunities. And if we have competition from licensed graduates, we should displace them from that. You understand? And we should create new opportunities which never existed. So that is my core interest. Existing opportunity, if you are capable, you will take it. But there should be somebody who should create new opportunities, right? never existed. We should try for that. And that is what I have done forever in my career. So I started a clinical pharmacy department in Warangal. I started a clinical pharmacy department in Bangalore, and I made US parties in India. So can you believe people from US come to India to get training for a month? And I am implementing another clinical pharmacy services in a hospital in Warangal. Any people from Kerala here? So this guy started his own clinic in Kerala. It's called a health mall. Everything which a patient needs, you will get in that one. Doctor consultation, laboratory test, diagnostics, medicines, physiotherapy, mother and child care, any cosmetics you want to buy, everything under one roof. And he is looking to expand into other places. For the first time in India, I am introducing pharmacists to manage medications of elderly people. So this is the project, and he is the CEO of the company. And this is me. This was the title. So this is in Chandigarh. So I am introducing the pharmacist as a clinical pharmacist for managing patients in Indian villages. So far we have. So I thought that I should not be satisfied with opportunities in India. I should create opportunities outside India. So luckily I met these two guys in Hyderabad. She said she's working as a clinical pharmacist in US for more than 20 years. So this guy is a researcher in US. So I'm partnering them to get some US work outsourced to India and deliver from India. So these are two US students, Bailey and Sarah, who came to can somebody take this book? I'll show you them. They are in India now. I left them in Delhi. Actually, today they are seeing Taj Mahal, but I missed Taj Mahal to see our. Okay. So they will fly out of India to US tomorrow. That's okay. Taj Mahal I can go later. I cannot after this conference later. So it is happening today. I made the decision. Taj Mahal versus Abhirami College. I select Abhirami College. So this year they are in India. They are very impressed with my work. I propose them a plan. So both of them are joining my organization. I will be the Indian partner. They will be my US partner. And luckily, Bailey's mom. So she is Bailey. She works for a long-term care pharmacy in US. That will be my client. Ideally, long-term care pharmacies in US are my client. I am looking to get some work from them and do it from India. So Bailey already introduced me for mom, and I will get my project. So this guy is an excellent. He studied pharmacy in India. He is an executive director for an elderly care facility in US. Today at 10:30 p.m. I have a meeting with this guy Bobby. So he has a $1 billion worth pharmacy in US. Most probably my first project from US can come from him. And this is Najib. So in introductions are said I am vice president for a company Saiwa based out of Canada. So he is Najib. He was in India. With him also we are doing certain things. So for first time in India again we introduced pharmacist as an under vaccination officer. So now in India pharmacist is taking care of vaccination in partnership with Rainbow Hospital. We launched it in Hyderabad, and this is Samri and Ambika. They did very well. And this is our vaccination center. This is a real image. So this is the vaccination center. So they decided to expand it because first project went well. We are recruiting 3 more people now. One in Marakal in Bangalore, one in Kodapur, Hyderabad, other one is Financial District, Hyderabad. So I am showing you all these new opportunities which never existed in India. But unfortunately all of them are no relevant for pharmacy. Because pharmacists should undergo transition from traditional pharmacy to clinical pharmacy. While continuing to do industry, QC all of them. So this is Dr. Vijay, he is advisor for Ministry of Health. With him we are doing participatory action research project. So this is for 25 years. If you get selected in this project, you can complete this project every time. So basically, if you want some outcome, so in students' case, if that outcome is a job, you should identify the factors which can result in getting you that job. And you should work on those factors, all factors in the same direction. That is, if what is here, what is here, what is here, what is there, you will not go here. This is called fishbone analysis. You can use this. You want to achieve something, Identify the factors which will favor achieving it and work on those factors. Then you will definitely achieve things in this. This is my latest project. It just happened Saturday. So this is an oncology hospital. This is an oncology doctor. He is owner of the hospital. So I made him a presentation on how we can recruit clinical pharmacists in this hospital and serve the patients better. Immediately I said these are the services I can provide and see the response, how proactive the doctor is. I sent proposal at 8:11. He responded at 8:23 and this doctor is not a small doctor. I can show his qualification. He said, I will do these things in 2 phases. He said, do all of them in phase 1. You understand? Means if you are capable, if you present yourself properly, you will have support from doctors like this, who are asking them to do all of them at once. Okay? And I am excited about that topic. So this guy is D.R.M.G. He is from Uttarakhand. With him we are going to start our WHO GMP certified manufacturing unit in Indore at a cost of 400 crores. Okay? So that mostly will come up in 2 years' time. So this should interest B-Farms. He's a party, he started his own pharma industry. Right now he's getting his drugs manufactured from a third party and selling in 5 states. But we are going to start our own manufacturing unit. And we are going to start another company to export nutraceuticals to US. Okay? And this is highly relevant to B-Farm and Farm, even farming. So these are so many other things. So thanks for the opportunity. So please convey my heartfelt thanks and gratitude for your management, principal, all your organizing team for making it happen. So though I have addressed hundreds of platforms, every new opportunity I get, I value it because that is giving me a chance to influence so many students sitting in front of me. And thanks all of you. You made a decision to come and sit here, otherwise you could have done anything else. So when I say time is same for everybody here. It is not just me giving 1 hour of my time to you. You are giving the same 1 hour of time to me. So I am very cognizant of that. Right? 1 hour is not greater than your 1 hour, right? It is the same. You understand? So thanks to all of you for spending your time today. I hope you make a decision to change your life and career. Okay? So thanks. And don't say me good morning sir, good afternoon sir. Even if you don't tell it, my mornings are good. 7-5, 6-9, 6-9 again, 2-8-5-3, 7-5, 6-9, 6-9, 2-8-5-3. Okay. So what I want from you is send me a feedback of what you felt listening to my talk. Don't tell me, sir, it was very informative. Thank you so much, sir. I know it is informative. I have 10,000 times in my book. Okay, what did you learn? What difference did it make to you? What one change you are going to make in your life from today after listening to my presentation? These 3 things you should send me. What new things did you learn? What difference those new things made to you? What change you are going to incorporate in your life based on what you learned today? So that should be the feedback format. It is very informative, sir. Thank you, sir. Excellent, sir. Wonderful, sir. All that I don't care. Okay? And as an organizer, I will forward all of that to you. See, ultimately, organizers' dream is what? People who came, who attended, got feedback. So you should make it a part to send that feedback to them also. Understand what I'm saying? It is like either you are appreciating their efforts. Understand? And it is not easy to host the event like that. I attended at least 50-60 conferences. So it takes a lot of time, effort, resource, so many things to make it happen. So we should be thankful for that. Okay? So that's it. Any questions I can take? During lunch time, if you want to interact with me personally, I will be available. And I always say, lunch we had many times in our life.
question to maintain silence. Sir, every great innovation starts with a spark. It needs a start, which results in the greatest success. So, what's your startup idea, or what made you make this Avenida Corporation?
Okay, so thanks for your question. So is this the first question for today? Clap for answer. So you understand the question, what inspired or what star gave you the star which influenced me to do this? So I will tell the basic foundation is when I joined farming, my own classmates were talking negative about farming. I wanted to change that perception. That is where it all started. Everything which I am doing today, for it, the foundation is auto-immunity. People are pursuing the course, the same people are talking negative about that course. You understand auto-immunity? I thought I should change that perception and show them that whatever you are doing is great. And if there is a fault, that fault is in you. So that is the foundation for everything which I am doing. I wanted to prove that this party is not so many. And so that's the only foundation. Any more questions?
Any other questions, ma'am?
You should ask questions. Otherwise, even for that I have something I call it self-viva. Viva means somebody will give question, you will give answer. So in events, nobody asks question. So I only ask question, I only give answer. I call it self-viva. How is that done? Next. I know what are the most common questions. But I want some last. So this guy was asking some negative. Yeah, my culture. Okay, you ask. We have my with you, we ask question. It is working. Anything, it need not be related to my topic. Just like, yeah, the one influence me to do all of this.
What's your vision? Industrial magazine. Importance.
What is my vision?
Industrial magazine, clinical magazine.
What is my vision? Siddharth? I don't have any vision. India is doing extremely well in industrial pharmacy. We should become part of bigger India's vision. In clinical pharmacy, my objective is to help pharmacists in India undergo a transition from a dispenser to a person who collaborates with doctor and delivers specific care to the patient. So that is my vision. And for pharmacy profession, my vision is wherever there is a medication involved, wherever there is a patient involved, pharmacists should involve themselves there. So I want to work in that direction. And when I say pharmacy, it can be D pharmacy, B pharmacy, M pharmacy, pharmacy. Wherever there is a patient, wherever there is a medication, it should be there. In different roles, from manufacturing to quality control to medical testing to R&D, to using all this knowledge to implement good clinical pharmacy practices. So more than that, we should have an our own vision. How can we become part of these things? So thanks for asking.
Any other questions, ma'am? Thank you, sir. Thank you for your wonderful session.
Kalau
Thank you.